Do you find yourself making endless trips to the bathroom? Waking up 2, 3, or even 4 times every single night just to urinate? For many people, it starts quietly, maybe once in a while after drinking tea or coffee in the evening. But over time, it becomes more frequent, interrupting your sleep, draining your energy, and making you feel restless during the day. At first, it may seem like just an annoying habit, something you can put up with or laugh off. But the truth is, your bladder may be trying to warn you about something more serious. Frequent urination can be the body's signal that an infection, diabetes, prostate problems, or even more complicated conditions are developing. Today, we're going to explore these hidden causes issues that only a urologist with their specialized training and diagnostic tools can properly identify and treat. Most people don't think too much about frequent urination. They tell themselves, maybe I just drank too much water today, or it must be because I'm getting older. And while those explanations can sometimes be true, they can also be dangerously misleading. Frequent urination is more than just a minor inconvenience. It can interrupt your sleep night after night, leaving you tired, irritable, and less productive during the day. Over time, that loss of rest can impact your immune system, your memory, and even your mood. Many people also begin to avoid social activities because they are embarrassed by how often they need to look for a restroom. This affects not only physical health, but emotional well-being too. But perhaps the most important reason not to ignore frequent urination is that it can be a warning sign of deeper medical problems. Urinary tract infections, for example, may start with urgency and frequency, but if untreated, they can spread to the kidneys and cause serious complications. Diabetes is another major culprit. High blood sugar forces the body to get rid of excess glucose through urine, often leading to increased thirst and frequent trips to the bathroom. In men, an enlarged prostate can slowly squeeze the urethra, making urination more difficult, yet more frequent at the same time. And in some rare cases, frequent urination can even point to kidney stones or bladder cancer. The bottom line is this: ignoring the symptoms doesn't make them go away. In fact, the longer you wait, the more complicated treatment can become. That's why paying attention early and seeking professional help is so critical. A urologist is a doctor who specializes in the urinary tract and, for men, the reproductive system. While many people first see their family physician for frequent urination, it is the urologist who has the deeper knowledge and advanced tools to uncover the real cause behind the problem. When you visit a urologist, the process goes beyond simply asking how many times you urinate in a day. They want to understand the full picture of your health. They ask about your medical history, when the symptoms began, how often you wake at night, your fluid intake, your medications, and even your lifestyle habits such as caffeine or alcohol use. Next, they may perform a physical exam, checking your blood pressure, abdomen, and for men, the prostate gland. They often order lab tests such as urine analysis to look for infection and blood tests to check for diabetes, cholesterol, or hormone imbalances. In many cases, imaging tests such as ultrasound or Doppler scans help the doctor see how well the bladder, kidneys, and blood vessels are functioning. This thorough approach allows the urologist to uncover issues that a general exam might miss. For example, a man who believes he urinates frequently only because of his evening tea may actually have an enlarged prostate or early diabetes. Without a specialist's evaluation, these conditions could remain hidden until they become much more serious. That is why the role of a urologist is so important. They don't just treat the symptom of frequent urination. They investigate the cause, connect the dots, and provide a plan that is specific, accurate, and designed to protect both your urinary health and your overall well-being. When you finally sit down with a urologist, one of their main goals is to uncover the true reason behind your frequent urination. While some causes are simple, others are far more complex and can only be detected through a specialist's evaluation. One common culprit is a urinary tract infection. UTIs irritate the bladder lining, creating a strong urge to urinate even when there is very little urine. Left untreated, infections can spread upward to the kidneys, leading to fever, back pain, and more serious complications. For men, prostate problems are a frequent cause. The prostate gland surrounds the urethra, and as it enlarges with age, a condition known as benign prostatic hyperplasia, or BPH, it presses on the urinary channel. This makes it harder to fully empty the bladder, so men feel like they need to go again and again, especially during the night. Diabetes is another important factor. High blood sugar leads the body to flush out excess glucose through urine, resulting in both frequent urination and constant thirst. Many people discover their diabetes only after a urologist connects these symptoms. Overactive bladder is another diagnosis a urologist might make. In this condition, the bladder muscles contract involuntarily, creating sudden, strong urges even when the bladder is not full. And while less common, urologists must also consider more serious conditions such as kidney stones, which irritate the urinary tract, or bladder cancer, which can present early with frequency, urgency, or blood in the urine. These causes cannot be identified through guesswork. Only a urologist with the right tests and experience can pinpoint the exact reason, and that accuracy is what leads to effective treatment. Once the underlying cause of frequent urination has been identified, the path toward treatment becomes much clearer. A urologist doesn't offer a one-size-fits-all solution. Instead, they tailor treatment to the specific condition affecting each patient. For example, if the problem is a urinary tract infection, a short course of antibiotics can usually resolve the symptoms quickly. If the issue is an enlarged prostate, medications that relax the muscles around the bladder or shrink the prostate can bring major relief. In some cases, minimally invasive procedures can restore urine flow and reduce nighttime trips to the bathroom. When diabetes is behind frequent urination, the focus shifts to controlling blood sugar. A urologist may work alongside an endocrinologist to adjust diet, exercise, and medications, ensuring long-term stability. For patients with overactive bladder, treatments may include medications to calm the bladder muscles, bladder training exercises, or in advanced cases, nerve stimulation therapies. Lifestyle changes are equally powerful in supporting medical treatment. Reducing caffeine, alcohol, and carbonated beverages can decrease bladder irritation. Maintaining a healthy weight and staying active improve both bladder health and overall energy. Practicing pelvic floor exercises like Kegels helps strengthen the muscles that control urination. Even simple adjustments, such as drinking most fluids earlier in the day and limiting intake before bedtime, can greatly improve sleep quality. The most important message is this: frequent urination does not have to control your life. With proper diagnosis, effective treatment, and supportive lifestyle changes, patients can regain their rest, confidence, and freedom in daily life. Acting early is the key to long-term success. Frequent urination might feel like a small nuisance, but it can be your body's way of signaling something serious. From infections and diabetes to prostate issues and even bladder cancer, the causes can vary widely, and only a urologist has the expertise to uncover the truth. The good news is that with proper diagnosis and treatment, most people see real improvements. Sleep becomes deeper, energy returns, and confidence is restored. So don't wait or hope the problem goes away on its own. Take action, schedule an appointment with a urologist, ask the right questions, and protect your health today. If this video helped you, please like, share, and subscribe for more health insights and empowering stories.